A very good day to all of you. I'm Dr. Lahari here, and today we're going to discuss about other imaging modalities. Now, the title might sound kind of very boring, but I promise you that this lecture I'll try and make it as interesting as possible. The learning outcomes would be very simple. Just for a year 4 level, you just need to recall the uses of some of the most important image modality that we will be discussing in this chapter, that is ultrasonography, CT, MRI, and nuclear scanning. Basically, all of the names that I've mentioned here are imaging techniques that are beyond the routine needs of general dental practice and are used for more specialized purposes. Computer tomography, magnetic resonance imaging, and ultrasound are considered as morphologic imaging techniques. That means they record macroscopic anatomic changes. Nuclear medicine, like the gamma scintillation camera or single photon emission tomography, also called as SPECT, and positron emission tomography, PET, are considered to be functional imaging. That means they provide information on the nature of the pathophysiological changes that are seen in the disease. Moving on, tomography as such, just to give you a reminder, is actually body section radiography. It allows you to see within the section of the body. For example, you have this huge loaf of bread here, and if you were to slice this loaf of bread into individual slices and look at each and every slice and the details that are present in each and every slice, that exactly is what is meant by tomography. So again, a reminder of all the three planes. The commonly used terminology is the coronal, axial, and sagittal planes. So let's first start with computer tomography. Computer tomography was first come into existence in the early 70s, and Godfrey Hounsfield and Alan Cormack are the ones who won the Nobel Prize in Physiology of Medicine for computer tomography. So the image that you're seeing here is that of a person who's lying down in this huge round structure which is called as the gantry. Computer tomography has come a long way since it's first being used, and now what we generally use is a multi-detector computer tomography or a multi-size tomography. It uses X-rays which are emitted from various sources, so multiple sources that are present within this gantry, and the patient lies down and the X-ray source rotates around the patient in a spiral or a helical pattern, which allows each and every part of the body to be or the area imaged to be exposed to radiation. So one thing very important for you to note down is the CT scan actually utilizes X-rays, and that's why there is a high amount of radiation dose involved. So these are images just to show you that this is an axial section. Here you can see the nasal cavity, and in this case you can see the teeth, and then the arrow marks are pointing towards a possible tumor that you're seeing in the axial section. The coronal section, on the other aspect, shows you the maxillofacial area with the clear details of the nasal turbinates and the maxillary sinus, and you could see number 8, which is pointing out to probably the teeth with a restoration or a crown, a metal crown in it, which is causing you some streak artifacts. And this is a sagittal section. So the indications for maxillofacial CT scan would be in terms of infections like osteomyelitis or space infection, midfacial and mandibular trauma, very useful in cases of trauma, developmental anomalies of craniofacial skeleton, benign intraosseous cysts and neoplasm of the jaws, benign and malignant neoplasms that originate in or extend into the orofacial soft tissue, and soft tissue cysts. Advantages of CT scan is, first of all, it eliminates superimposition of images outside the area of interest, so giving you a very clear image. It has inherent high contrast resolution, and hence the differences in densities between tissues can be appreciated very well. The data from a single CT image can be viewed as images in axial, coronal and sagittal planes or any arbitrary plane. So that's what we call as multiplanar reformated imaging. And when you compare a CBCT to a CT scan, and we're going to use the word multi-detector CT scan, because we've already dealt with CT scan in maxillofacial region, the main differences is that the CT scan has a very high radiation dose in comparison to that of a CBCT scan, and yet it has lesser spatial resolution. So for most intraosseous pathologies in the bone, a CBCT is considered adequate now that we're using CBCT more often and is available more easily. Whereas a CT scan has high contrast resolution and gives you much more excellent visualization of soft tissues. So if there is evident or suspected soft tissue involvement, then CT is a preferred modality rather than a CBCT scan. So if you were to look at these parameters of soft tissue contrast resolution, a CT scan or a multi-detector CT scan has excellent contrast resolution for the soft tissues in comparison to a CBCT scan. The spatial resolution is quite low. It gives you only 0.5 mm, where that of a CBCT is much more clearer. Whereas radiation dose for a CT scan is very high in comparison to that of a CBCT scan for that area. So the term contrast CT is used when contrast agents are used. They are injected via IV, administered via IV. That's generally iodine based contrast solutions, which are used to improve visualization of the surface between the tissues. Iodine is one dye which absorbs X-rays, and hence it makes the area more visible on a CT scan. So for example, the normal subcutaneous fat has a dark, nearly black appearance. The inflamed subcutaneous fat has a smoky appearance. If you've noticed on this side, there's a swelling on this side. Abnormal parotid gland marked enhancement with contrast in it, giving it a bright whiter appearance. And the normal parotid on the other side is soft tissue density not having contrast in it, is substantially enhanced with contrast. So that is the importance of injecting a contrast media and visualizing the area, which gives you a lot more detail. On the other hand, let's move on to magnetic resonance imaging, which also uses a gantry, and the patient has to lie down in this. This was first used or described by Paul Lauterbur and Peter Mansfield in 1973, and it was used and developed for clinical use only in the 80s. They were given the Nobel Prize for Physiology and Medicine only in 2003. When you look at the scans, the sections look very similar to a CT scan for someone who's novice, but when you look at them more clearly, you will understand that there are differences. So this is an axial MRI, and this is a coronal section, and you will notice that there are differences, and this is, for example, a sagittal section. So the differences in MRI and CT scan is that there's a lot more better soft tissue visualization in an MRI scan. So the applications of MRI in the maxillofacial area for maxillofacial diseases is first of all evaluation of soft tissue conditions, position and integrity of the TMJ articular disc. The reason why I've marked it in red is virtually MRI is one of the best methods of visualizing the articular disc, and one of the best applications in the head and neck region or in the maxillofacial region would be to evaluate the TMJ. Other than that, MRI can also be useful in visualizing neoplasia of the soft tissues like the tongue, cheeks, salivary glands and neck, specifically malignant involvement of the lymph nodes and perineural invasion, salivary gland diseases like the cysts, neoplasm, infections and obstructions, vascular lesions, and suspected early osteomyelitis of jaws to determine edematous changes in fatty marrow and surrounding soft tissue. The advantages of MRI is it offers best contrast resolution of soft tissues. There is no ionizing radiation involved. This is something very important to be noted. and direct multiplanar imaging is possible without actually reorientation of the patient at all. This is, for example, MRI of the TMJ region. You can see the different anatomy here. Just to orient you, this is the condylar head and this is the external auditory meatus. You will notice that this is the disc, the posterior part of the disc, the anterior band of the disc, and the middle portion of the disc, which gives you an idea as to how clearly the disc can be visualized. So this is just to show you comparatively. This is an MRI image of the medial section of the disc. This is an autopsy image where you see the TMJ, the condylar head, and this is the disc that is seen. On the open mouth MRI, the image appears to be anteriorly, the disc, appears to be anteriorly displaced, and just as you are seeing it in this image here. So, of course, MRI comes with its own set of disadvantages, some of them being long imaging times. Sometimes the patient is made to lie down in the gantry for as long as 45 minutes, which can be quite long, and because of which patients with claustrophobia have inability to tolerate confined spaces within the scanner, and it really tests the time that the patient can actually lie down still within the scanner. MRI is contraindicated in the presence of ferromagnetic metals. For example, foreign objects which are implanted electronic medical devices like cardiac pacemakers, cerebral aneurysmal clips, and in patients with embedded ferrous foreign bodies like shrapnel or bullets. What happens is the strong magnetic fields that are created in an MRI may move these objects. So it could also cause excessive heating or induce strong electric currents which can harm the patient. So if the object moves, which means that the pacemaker or a aneurysmal clip, which is supposed to be in one particular area, because of the magnetic resonance imaging, the magnetic field created, it moves this object, and it obviously can cause harm to the patient rather than actually benefiting the patient. Also, dental restorations, titanium implants, orthodontic appliances, they do not move, but they could cause distortion of the final image, and hence the image that you're trying to see could be marred, or the quality of the image could be highly diminished. And there are some special considerations in during imaging of patients with orthodontic appliances. If they are removable appliances, they should be removed. Steel arch wires, especially the stainless steel arch wires, they need to be removed as well, because they can also cause a lot of distortion, or they could cause image a noise which allows which may make it difficult for the image to be diagnosed well, and hence brackets, bands, and fixed retainers also need to be checked to ensure that they're securely attached, because all of these are made of stainless steel, which could move due to the strong magnetic field created during the MRI procedure itself. Moving on to ultrasonography. Now that's how an ultrasonography machine looks like, and this is what we call as a transducer or a receiver. The sonography is a technique based on sound waves that acquire images in real time. That means as the patient is sitting down and the area is moving, you can actually visualize the moving parts of the body. So again, there is no use of ionizing radiation, so that's something very important that needs to be noted down. Diagnostic ultrasound uses vibratory frequencies in the range of 1 to 2 megahertz, and this transducer here acts as a device which releases the sound waves as well as receives the sound waves. This is just on a lighter note, is to show you how it can be the most popular use of ultrasound is for pregnant women to look at the fetus, development of the fetus. So the applications in head and neck region is evaluation of neoplasm, especially in the thyroid, parathyroid, salivary glands, and and lymph nodes. Stones in salivary glands or ducts can be visualized. Sjogren's syndrome, blood vessels of the neck, example carotid artery sclerosis, to guide fine needle aspiration cytologies in the neck region. 3D imaging to allow multiplanar reformatted imaging, surface rendering, example if you're looking at the fetal face, and color Doppler sonography for evaluating the blood flow. Now this is specially used if you're looking at an AV malformation, arteriovenous malformation. This is an example of how lymph nodes with calcifications look like on ultrasonography. I can understand that it's very difficult to make out in the image that which part of the body you're looking at, but that's how it is. So a trained sonographer actually can visualize what area that you're looking at clearly, but just by looking at these images, it's very difficult to say which part of the body you're looking at. This is, for example, how color Doppler looks like. This is an 4D ultrasonography of a child, a fetus, which you're seeing, and very clearly the face of the fetus and other deformities or any kind of anomalies can be made out very clearly in the ultrasound. This is an example of a pleomorphic adenoma. You can see the swelling of the patient here, and then that's how the ultrasonography enables us to visualize the parotid gland and the presence of a tumor. This is color Doppler ultrasonography used to visualize a swelling in the maxillofacial region, and the color Doppler helps us to determine this is actually a vascular lesion, and it helps us even to understand that which is the artery, which is the vein, and how are they intermingling. Moving on to nuclear medicine. Radionucleotide imaging is a form of functional imaging. Like I told you in the beginning of this chapter, this imaging modality helps in assessing the functioning and abnormal biochemical processes of certain human diseases. So it's basically used for assessing functioning of the brain, thyroid, heart, lungs, kidneys, and GI tract. Also used for diagnosis and follow-up metastatic diseases, bone tumors, and infection. So the most common use is that in cancer patients, where the progress of the disease can be used to can be determined using nuclear medicine, and also whether the disease has progressed to metastatic or where the primary tumor is and where is the secondaries. Those are all very clearly visualized using nuclear medicine. What essentially is done in this is a radionucleotide dye is injected into the patient, and the one commonly used is technetium protectate, and it has a half-life of 6 hours. So when injected IV, it gets concentrated in glands such as the salivary gland, thyroid, and gastric mucosa, and also it can be bound to other molecules to image the bone. So what it does is it emits gamma rays, but not charged particles, which can be detected by a gamma scintillation camera or an Anger camera. So essentially what happens is when the dye is injected into the body and the patient is inside a large huge gamma camera similar to the scanner used in a CT or an MRI scanner, it gets concentrated in all parts of the body, the dye, and then where based on the area where it is accumulated, the the imaging modality helps us detect the function or the defect in that particular area. This is a case, for example, of a 14-year-old female patient with chronic osteomyelitis. On the panoramic radiograph, we are able to visualize expansion and sclerosis of the mandible on this side. Just compare this area to the other side, which appears normal. So there is an osteomyelitic region here, which is not very obvious on this panoramic radiograph, and that's the reason why this patient was subjected to a SPECT, which is a single photon emission computed tomography. You see that there is increased activity in the posterior mandible on this side. Okay, so that is planar radionucleotide imaging. And this is how a SPECT image looks like: excessive amount of uptake of dye and increased activity in the posterior mandible. So when a CT scan was taken for this patient and a SPECT was taken and both of these images were fused, you can see that there is increased activity on this posterior surface of the mandible, indicating that exact location of the disease. On the other hand, positron emission tomography or PET is also a method of nuclear imaging used to visualize the human body, the functioning. This is an example of FDG PET CT scan. FDG is a molecule. I'll come to the details of it in a while. Here it has been utilized to image a patient who has fibrous dysplasia. If you've noticed that there are three spots which have been highlighted here, where you can see that there is increased uptake of the dye, and the corresponding CT image shows us that there is radio opacity changes to show you that there is some changes in the bone here. Right, so this case shows the three different areas where the bone has shown fibrous dysplasia changes, and mimicking malignancy very closely. So that's why probably this patient was subjected to positron emission tomography to understand the pathophysiology of this disease. So the FDG stands for fluorodeoxyglucose. It is just one molecule that is used in this PET scan. So PET imaging is a lot more sensitive than the gamma camera, 100 times more sensitive, and it uses positron emitting radionucleotides like the fluorodeoxyglucose. So in this case here, which you can see, the PET scan shows abnormal focal uptake in the region of the stomach, showing that probably there is a tumor here. And on the other hand, the urinary bladder and the brain cells show normal uptake of the dye. So the applications of nuclear medicine in maxillofacial disease, especially for bone scintigraphy and SPECT, would be to visualize primary and metastatic bone diseases, also to understand the progress of the disease, or whether the disease is progressing further or has the patient healed, and TMJ abnormalities like condylar hyperplasia and resorption, osteomyelitis, osteonecrosis of the jaws, skeletal dysplasias like fibrous dysplasia or Paget's disease. PET scan can be used to monitor metastatic bone disease, primary and recurrent malignancies, and osteomyelitis as well. To end, I would just like to introduce the term called as image fusion. This is the term used when multiple patient images are registered and overlaid or merged to provide additional information. Fused images may be created from multiple images from the same imaging modality, or by combining information from multiple modalities such as MRI, CT, PET, and SPECT. For example, this is a fusion image where they have merged the images of a PET, MRI, and CT to get much more detailed information of the tumor, the spread of tumor, and the extent of the tumor. This, on the other hand, is a combination of a PET and CT fusion, which shows you the image of the head and neck area and where the dye has been taken up, and details of where the tumor involvement is. So that's all for now. This is a simple class, a small class. I hope you've understood. If you have any doubts, please get back to me. You can text me, or you can also write in the comments, and then I'll get back to you. For more details, I would suggest that you read the textbook. It gives you a lot more details, and if for in-depth understanding as well. Thank you.